Namaste, myself Dr. Deepa. Today's topic is about oximeter. Nowadays, everyone are suffering from COVID, so everyone will be knowing that what is the importance of oximeter. So why we are using this oximeter? Actually, for knowing our saturation, oxygen saturation level in our body. What is this oxygen saturation level? In our body, we are having the major organs called as lungs. So while doing respiration, while taking air inside, we are getting oxygen, and in our lungs, alveoli is a small parts in that. So while exhaling, at the time, these alveoli will they will increase their size and they will receive the oxygen. After that, these oxygen particles are carried by our blood cells to hold over the body. By getting these oxygen only, our body will maintain a good function. If we are not getting enough oxygen, then it will cause death of each organ in our body. After this oxygenated blood is taken to all the parts, after that deoxygenated blood is taken to the lungs, and after this process carbon dioxide is released out. This is the process of respiration. So normal saturation level in our body in a healthy person is 94 to 100. So whichever readings 94, 95, 96, 97, 98, 99, 100 is normal. If it is below 94, means 91 to 94 is considered as mild hypoxia, and from 86 to 90 is considered as moderate hypoxia, and less than 85 is considered as severe hypoxia. What is this condition called as hypoxia? Hypoxia is oxygen supply is insufficient to our body. This is called as hypoxia. So I have explained the process of the saturation by these molecules, saturation process in our body. And next we want to know that in which hand we should use our oximeter. So many people are right handies, or many people will be lefties. So if they are left hand using person, they can use in the first or second finger of our hand. Of if you are using more left hand, you can use in the left hand, or if you are using more right hand, you can use in the right hand finger. So how we can test this? We can just clip that machine to our finger, and we can wait for some time, for 30 seconds. These two readings will be coming in the oximeter. One is saturation level and next is pulse rate level. So our oxygen saturation level should be between the 94 to 100. This is the normal range. And what about the reliability of this machine? 2% will be more or less. So you can consider as 2% more or less in many times. Then we should, it is having a baseline. What is this baseline? Some person's body is having some nature, so that is called as the baseline. So before you are suffering from COVID only, you can just check your oxygen saturation level with this oximeter. Just we can check that it is working or not. So that is the thing. Next, how we can get the false readings with this oximeter? This is, many conditions are there. One is nail polish or mehendi in our fingers, or someone will be having some fungal infections in our nails, or cold hands, or sometimes it will be because of that dirt, or some type of dirt in your nails. It is also, and sometimes it is light, if your light focus is not bright or a little bit dull, that may be also a reason. Next is, for whom it will be that the oxygen saturation level is lesser. It may be to the COPD patients or emphysema cases, respiratory related diseases, pulmonary fibrosis or fluid in lungs or lung cancer, heart related patients, or with the COVID patients or ARDS, acute respiratory distress syndrome, or asthma patients, etc. So one test is there, ABG test. What is this ABG test? ABG means arterial blood gas test. But the problem is we can't do this test for all the patients, all the COVID patients. So it is a little bit, it had made to a small device for the comfortable of the patients, and it will, if it is there in all houses, it is well and good during this COVID pandemic situation. Next is which all are the symptoms we should use this oximeter. If you are a COVID patient, or if you are having any diseases earlier I have mentioned, or if you are feeling with shortness of breath, or severe headache you are having, or fever, persistent fever for 2 to 3 days, or rapid breathing is there, or increased heartbeat, or increased hypertension, or cyanosis. Cyanosis means that bluish discoloration in your body parts, or if your this one respiratory rate is greater than 30, or while the this one pulse rate, heart rate is more than 125, or if your capillary refills with less within the time of less than 2 seconds. So less than 2 seconds it is normal, but it is not filling less than 2 second time, then you should go to a doctor. And if your saturation level is dropping, these are the major symptoms for this condition. Next is in this COVID situation, many are asking that how this oximeter is working. This is a process of two light rays are there. One is a light sensor. Due to the light sensor, infrared rays is there and red light is there. It is going through this finger. This light ray is going through this finger, and how it is capturing by the this side. It is the main thing observed here. And oxygenated blood cells, by watching the count of the oxygenated blood cells, that saturation level is mentioned in that oximeter. So many things are there. COVID patient can do RT-PCR test, otherwise that HRCT scanning is done, or X-ray is taken. Many times it is also happen that the people are getting negative RT-PCR results, but they are having the symptoms. So it is also considered as COVID positive only, because if they are getting all the symptoms, all or 2 to 3 symptoms, mainly COVID having many symptoms, they are fever, persisting fever for 3 days, 101-degree temperature, severe headache, severe body pain, loose motions, very rarely vomitings, or sometimes eye problems are also there, and like that only body ache is there. So many symptoms are there for this COVID. Conjunctivitis, the like condition, skin rashes will be there. So many conditions are there that is actually changing. Symptoms are also changing. So we should be very careful during our while we are going outside and all. We should maintain social distancing. You can use two masks, one N95 and cloth mask, otherwise one surgical mask and one cloth mask can be used while going out of the out of your house. So if we are taking precautions very well, it is well and good. Otherwise it will be very critical situation we should face. So try to be very safe and very careful during these days. If you have any doubts regarding to this COVID or pandemic situations, please you can mention in the comment sections. And if you are feeling that this video is useful for you, you can share and you can subscribe. So thank you very much.